Hi, this is Erica De Leon, your friendly mental health advocate. For today, we will be discussing psychological trauma management. Now let's take a look at the history of psychotrauma management. Psychotrauma was rooted in the work of French neurologist Jean-Martin Charcot in the later part of the 19th century. In 1887, he posited that symptoms of hysterical patients were psychological in nature and inflicted by trauma. Even after his death, Charcot's students, Sigmund Freud and Pierre Janet, pursued to find a cure for hysteria. Both believed that the symptoms were the result of distorted state of consciousness produced by the horrendous emotional reactions to the traumatic event. They discovered that to some extent, symptoms could be improved if the patient is able to verbalize the hysteria. Thus, this marked the beginning of psychoanalysis. During World War I, the study of psychological trauma emerged. A British psychologist named Charles Myers termed shell shock, describing soldiers who suffered from a nervous condition because of prolonged exposure to war. During the 1920s, Abram Gardiner delved into the topic of combat neurosis. In 1941, he published his book, The Traumatic Neurosis of War, paving the way to the improvement of frameworks of traumatic syndromes. It was not until the Vietnam War that interest in combat neurosis resurfaced. In 1980, PTSD was recognized by the American Psychiatric Association as a distinct mental disorder. Finally, PTSD was incorporated into the third edition of the Diagnostic and Statistical Manual of Mental Disorders. Concurrent to this, the development and further improvement of clinical interventions focused on healing and recovery flourished. The result of these events, various treatments were created and developed to provide help to trauma patients. Common treatments include exposure therapy, EMDR, and cognitive processing